Let's begin our lecture of the tumors of oral cavity, and in this first section we will discuss the benign tumors of the oral cavity. Topics which will be discussed in this section will be the papilloma, fibroma and pyogenic granuloma, haemangioma and lymphangiomas, and also torus and other benign tumors of the oral cavity. So the classification of the tumors of the oral cavity, we have the benign tumors which are further divided or classified into two: the solid benign tumors of the oral cavity and the cystic oral tumors, benign tumors of the oral cavity. Solids are solid, hard. Cystics or the cysts are the fluid filled sacs which are soft. They have fluid inside, and those are the cystic structures. Then we have premalignant lesions. Premalignant is the stage before the malignancy develops. That's the premalignant stage or lesion. And then we have malignant lesions, which are the carcinoma. And then we have non-squamous malignant lesion. So carcinoma will be the mostly the squamous cell carcinomas, and the other classification of the malignant is the non-squamous cell carcinoma. So these are the three broad classifications of the tumors of the oral cavity. We have benign tumors, premalignant lesions, and then the malignant lesions, which will be further subgrouped into these carcinoma, which will be the squamous cell carcinoma, and then we have the non-squamous type of malignant lesions or the cancer. These are the some pictures of the tumors of the oral cavity, more solid type, and these are like the cystic swellings with the presence of fluid, and they are the softer lesions. Next, the benign tumors of the oral cavity. We said they are of two types, solid and the cystic. So let's talk about the solid tumors of the oral cavity. First, different types. We have papilloma, fibroma or fibroepithelial polyp, pyogenic granuloma, haemangioma, lymphangioma, torus. Then we have pregnancy granuloma, granular cell myoblastoma or cell tumor. Then we have minor salivary gland neoplasm. So all these are the different benign tumors, solitary fibrous tumor. Different benign solid types of the tumor of the oral cavity, they are solid. And as we know that the tumor or growth is the term oma is used for them, and usually fibromas, granulomas, these are all the tissues from which these swellings or the tumor grow. And then we have one pregnancy granuloma. As the name shows, they are more common during the pregnancy. Then we have minor salivary gland neoplasm. Salivary glands are major and minor. Major salivary gland is the parotid gland, and then we have minor salivary gland. So all these are the benign tumors of the oral cavity. Papilloma, fibroma and pyogenic granuloma. These are the pictures. You can see the papillomas, then we have fibromas from the fibrous tissue, and this is pyogenic granuloma. Pyo is with the pus, they have pus in it, and this is the yellowish is the pus present in the pyogenic granuloma. So papillomas, they are common. So papillomas are common benign tumors of the oral cavity. They are formed on the soft hard palate, uvula, tongue, lips. So all these structures of the oral cavity are affected by the papillomas. Papillomas are pedunculated and white. Here you can see these are the papillomas. They are pedunculated, have stalk, whitish in color. They are present on soft palate, hard palate, uvula, tongue and lips. So all other than the floor of the mouth, all the structures are affected by the papillomas. And the treatment is excisional biopsy. The polyps, the papillomas are excised, removed, and biopsy is performed to look if they have any malignant transformation or not. So these are the papillomas. They are common benign tumors of the oral cavity. Fibroma. Fibroma are the smooth mucosa covered pedunculated. So they are smooth, they are mucosa covered, and they are also pedunculated, soft to firm in the texture. They are soft to firm. Occur anywhere due to chronic irritation. So any part of the oral cavity is involved as a result of chronic irritation. When there is constant irritation as a result of some chemical or handling, this constant irritation can lead to the formation of fibroma, and the treatment is also surgical excision. Pyogenic granuloma due to trauma is pyogenic. So pyogenic is mainly due to some superseding infections, pus formation. So it's also due to trauma or chronic irritation. Involve anterior gingivae. So this develop on the gums. In the gingivae, it's soft, smooth, reddish to purple mass. Soft, smooth, red or purplish mass with the formation of pussy area, pyogenic area. Treatment is surgical excision. So these are three types of benign tumors of the oral cavity we discussed so far: the papillomas, fibromas, and pyogenic granulomas. Among these, papillomas are common and they occur all on the soft palate, hard palate, tongue, lips, and the uvula. And for all them, the treatment is the surgical excision, and the biopsy should be performed after the excision. Haemangiomas. Hema is for the blood, angio is for the blood vessel. So it's the tumor of the blood vessels or the arteries. Haemangioma. Mucosal hemangiomas is present on the mucosal surface. Three types: capillary, cavernous, and the mixed capillary and cavernous type. This is the picture of the hemangioma. This is more like cavernous hemangioma, which occur after a period of time when it leaves the scar on the skin, and it is due to the involvement of the small blood vessels, capillary under the skin, that leads to the formation of the plexus. So capillary, cavernous, and both capillary and cavernous mixed type of angiomas are present. There is phlebostasis. Phlebo is for the veins. Stasis is the stopping of the blood in the veins. Phlebostasis is present. Hard to differentiate from pyogenic granuloma. So that one is also reddish purplish. So it's hard to differentiate it from the pyogenic granuloma. The treatment is microembolization alone or as a preoperative adjunct to surgery. So it can be microembolization can be used alone or it is used along with the surgery, before the preparation for the surgery, microembolization to control the or to block the capillaries so it should not form the plexus or should not form the collection of the blood or the tumor. Lymphangioma, again, the lymphatic vessels are involved, lymph vessels, lymphangio is vessels, so lymphatic vessels are involved in the lymphangioma. Involve anterior two-thirds of the tongue. So anterior two-thirds of the tongue is affected by the lymphangioma. Cause macroglossia. So anterior two-thirds of the tongue is affected. Macroglossia is enlargement of the tongue as a result of the lymphangioma. Present as localized soft swelling. Small lesions should be treated by excision. Large lesions is partial excision. So small lesions are treated with complete excision, and the large lesions are treated by the partial excision, and the lymphangiomas mainly involve the anterior two-thirds of the tongue, and there is enlargement of the tongue, macroglossia, and they usually present as the swelling of the anterior two-thirds of the tongue. Torus is the submucosal bony outgrowth. So submucosal, below the mucosa, bony outgrowth is the torus. Involve hard palate or the mandible because it's the outgrowth of the bony structure. Hard palate has the bone, then we have mandible or the lower jaw, so it's involved that area, hard palate and the mandible. Palatine torus is common. Present as rich nodule or lobulated mass. So you can see these are all the torus, which are the bony outgrowths, involve the mandible, involve the hard palate. Palatine is more common. In the palate, it's more common and present as the nodule or lobulated ridge. So these are the hard palate structure present as the nodule or the ridges. Mandibular tori develop from the lingual aspect of the gingiva. Lingual aspect of the gingiva from the portion of the gums towards the tongue. Lingua is the site where the mandibular tori is formed. Usually mandibular torus is bilateral, develop on both sides of the mandible. Innocuous and resection is indicated. Innocuous, it's not dangerous, not harmful, it's harmless, and the resection is indicated, should be resected and removed. So the torus is the submucosal bony outgrowth. Mainly it involves the hard palate and the mandible. Hard palatine or palatine torus is more common as compared to the mandibular, and if it's mandibular torus, then it is usually the bilateral torus. Some other benign tumors of the oral cavity, we have the pregnancy granuloma, and it's similar to pyogenic granuloma. It is common in the first trimester, first 3 months of the pregnancy. This pregnancy granuloma develop. Treatment is by the excision. Then the granuloma, granular cell myoblastoma is another benign tumor, and it occurs in the tongue, and it is derived from the Schwann cells. Schwann cells are the cells that covers the nerves, and the Schwann cells. So it involves mainly the Schwann cells. and present as firm submucosal nodule. Surgical excision is the treatment of the granular cell myoblastoma, and this myoblastoma developed from the Schwann cells. Congenital epulis in the female infants. Then we have minor salivary gland neoplasm, which are pleomorphic adenoma, occurs in soft or hard palate or anywhere. Painless submucosal nodule and wide surgical excision is the treatment for the minor salivary gland neoplasm. Then we have solitary fibrous tumors. Solitary means single, not multiple. So solitary fibrous tumor, they are common in the pleura. Painless, mobile submucosal tumor arises from the mesenchyme, which are the cells of the embryonic stage or embryonic development mesenchyme. Capillary proliferation and the pericystic pattern of the solitary fibrous tumor. So these are the benign tumors of the oral cavity. And the solitary fibrous tumor, we have complete surgical excision or complete removal of the solitary fibrous tumor, because its solitary surgical excision is easy and it is removed as a whole and complete. So complete surgical excision is done and it arises from the mesenchyme. So that was all about this section. Thank you for watching sqadia.com.